Now, throughout this week, more and more of us in Lancashire have been heading to clinics to get the new coronavirus vaccine.
In Lancaster, nearly 1,000 people aged over 80 had their jabs at a special clinic at the new Health Innovation Campus at the university. BBC Radio Lancashire's Tim Padfield went along and spoke to Jo Rycroft-Malone, one of the organisers from the university.
We're so proud that this is happening here. We've had a central role in the community around the COVID-19 experience, and this is just the latest of our contribution to COVID-19 and fighting this virus.
So what makes this building so appropriate? Because, as I say, I live in the city, and my first thought was, it's not in the city centre. That's quite surprising, but there's lots of reasons why this is a good place.
This is a great space. It's, as you can see, it's a big space, so it's really easy to make it COVID secure. It's accessible, which makes it easy for both patients and staff to come in and around the building, and it really, in the sense of innovation being in the title of the building, it's perfect, because this is certainly going to be one of the most innovative developments in my lifetime. So it's wonderful that we can host it here.
So how did it come about? Did you offer the services to the local medical community, or did they come to you?
We have an existing relationship with the medical practice. So the medical practice are our medical practice on the campus. Also, the medical practice supervised some of our medical students, so we had that existing relationship, and really that was the start of it, and we've spent the last few weeks working together on getting this initiative up and running.
What have you had to put in place to make it happen? Because obviously I've seen stewards out in the car park making sure people can park correctly. There's lots of older people who may be infirm, frail, need support getting into the building, whilst keeping things socially distant. There's quite a bit of work to make it function.
There's been a lot of work up until this point, and also now to make it function. So our team, our facilities team, our estates team have been working with the medical practice team to make sure that things do run smoothly, and certainly in these early days they'll be learning from the experience and tweaking things and making sure that they continue to run smoothly as the vaccine continues to be rolled out.
And I suppose at this point a bit of luck is that the students aren't around. They've finished for Christmas, haven't they?
The students have indeed finished for Christmas. Our medical students who do occupy this building finished a week or so ago, and so absolutely the building is got a few staff in, but generally until the new year it's a good space to get going and give this vaccine programme its first go.
For quite a while now, the university's been very keen to improve its links with the community, hasn't it? The town and gown issue we talk about, the fact that the university is a couple of miles outside the city centre, could be seen to be just a place for academics and students. I suppose this is an ideal way of sort of advertising that it isn't that, it is a community facility.
Yeah, we do take this as really seriously, our role in the community extremely seriously. So you'll probably be aware that we graduated medical students early so they could work in the community early on in the pandemic. We've got an asymptomatic and symptomatic testing site on the campus. So this is the next step in respect of our role with COVID-19 and our role as a central part of this community.
That's Jo Rycroft-Malone from Lancaster University talking to Tim Padfield there about the special coronavirus vaccination clinics which were held at their new Health Innovation Campus. We heard